Hi, welcome to Detours Understanding Acquired Brain Injury. And this is Essentials of Acquired Brain Injury, Infectious Encephalitis. This is part 3. So what we're going to be talking today, obviously, is about infectious encephalitis. And just like with infectious meningitis, we talked about how encephalitis and meningitis in that case, there are non-infectious, that is, forms of meningitis or encephalitis in this case, that can be caused by intrinsic factors, things like cancer, things like problems with genetics or with epigenetic factors, things that have nothing to do with an external cause, that are caused by internal malfunctions of the body that lead to an inflammatory response by the immune system, think autoimmune in this case, that lead to the same kind of response. The primary difference here with infectious encephalitis versus infectious meningitis is the target of the organism. In this case, it's more about infecting brain tissue. But the division between meningitis and encephalitis is kind of an artificial one, which is why there's a term that's used, meningioencephalitis, and oftentimes there is crossover between the two. The thing is, it's, you might say, oh, well, it's this or that, but it's really just more whether it crosses over into the brain or not. Although, it's important to note that there are some organisms that really do have an extremely difficult time infecting the brain itself, but damage to the meninges or elevated intracranial pressure definitely will damage the brain itself. And so, regardless of which one it is, either meningitis encephalitis or meningioencephalitis can be fatal. So it's important to treat either with the severity they deserve. Now, I know people would say, why would I treat any kind of infection that affects the brain or condition? But there are some people who are like, nah, I'll tough this sickness out because they're afraid of doctors, hospitals, or there's an issue of trust or whatever. And the fact is, this is one of those things that toughing it out, it just doesn't work. You've got to bow to the fact that these kill, and yeah, you do need help. This is not one of those things, gee, I'll cut it out myself. No. I just want to stress that fact here. All right, so again, as with meningitis, due to the complexity of infectious encephalitis, I have notes, so I will be referencing them to make sure I have the most up-to-date information here. And this is also an important note for any medical providers or anything like this. Please make sure you're always up to date. I know I shouldn't have to say this, but, all human beings do tend to get into a habit. So it's always important to keep your information as up to date as possible. And who knows, in 3 months, this may be out of date. So as of January 2024, this is up to date. And this applies to anyone watching also, and ties directly into what I'm going to say. This is not meant as a substitute for proper medical care at the hands of a physician or some provider who's taking care of you in an emergency situation. This is not meant to substitute for medical care. This is merely educational and just for information and for some explanations of things that, if you or a loved one is under care or has been, explaining some of what happened, so you understand better. But this is certainly not meant to substitute for medical care. If you think you or a loved one, as in all these kinds of videos, has something going on that has led to acquired brain injury or might, any of these kind of things, if you have a medical emergency, call 911 or go directly to the emergency department. These conditions are potentially fatal or disabling for life. All right, enough of that. Now let's get into this. So, infectious meningitis. The symptoms, again, are very similar to, infectious encephalitis. The symptoms are very similar to meningitis. You typically see the headache, the stiff neck in some cases, the fever, the confusion, vomiting. So the one major difference is that they may be less severe, and many patients who have encephalitis can recover with no effects. It depends on what type of encephalitis they have. But you can't tell that without further information, because some types of encephalitis are lethal or leave with severely permanently disabling effects. And you don't know what type you got. There are no specific signs that differentiate them. So it's kind of a toss of the dice. This is why you need to get checked out. Bacterial meningitis, as we had spoken to previously, it's high chance of curtains regardless. But with encephalitis, there are some that aren't quite as nasty. Your chances are much better, and chances of even walking away, ironically, are better. Partly because with meningitis, you also see a lot of edema and other things. Whereas encephalitis, the mechanics are a little different. All right, so obviously, what are causes? The big one for encephalitis, infectious encephalitis, where it affects the brain tissue directly, viruses. That's the big one here. Bacteria, less so. After viruses, then you're looking at fungi, and again, that notorious trash can category, protista. Again, when it's weird, it's protists for some reason. Probably just because the protists are weird. So, what are the ways of dealing with these? Vaccines. Yep. Prevent them before they happen. There are some vaccines that are given for viruses while you have it, but this is less common than preventative vaccines. Basically, to teach the immune system, look out for these guys. But yeah, that is the most common. Then there are the antivirals, which inhibit replication or fusion with cells, modify the immune response, antivirals. There are also anti-sera, antitoxins, essentially, which take monoclonal antibodies or polyclonal antibodies and are used to, again, modify immune response. We saw this during the COVID outbreak, where they used either convalescent serum, which is basically from people who got better after getting COVID, and then they used the antibodies from them to help the function of the immune system in a person who was sick with COVID in order to help their body recognize the virus. It wasn't as effective as they thought, and so this is why, it's like they didn't use it for long, but oftentimes it can help. So this is where if you see something that ends in MAB, M-A-B, it's a monoclonal antibody, which is basically a cloned, highly modified antibody production-based medication that helps the body to identify basically things that cause inflammation or identify cells that are not functioning right. So it's used in cancer treatment, it's used in inflammatory autoimmune diseases, things like that. That would apply to non-infectious encephalitis or other conditions. But we're not talking about that at the moment. So sorry, I digress. I do that quite often. I did want to bring up something else. Some types of infectious encephalitis can cause things like hallucinations, visual, auditory. They can cause seizures. That's a big one too amongst the encephalitis versus meningitis. Encephalitis can cause seizures more often, especially some of the viruses do. Just touching on some of the notes. You also, for kids, they may not present with fever. They're more likely to be generally irritable and hard to console. They'll have problems with their appetite. They'll be drowsy, stiff neck, definitely, but that's, again, a meningeal sign, but you will see this. In the majority of cases, you may not even know what brought about 40-50% of the cases, you may not even know what brought about the encephalitis. For as I said, for encephalitis, infectious encephalitis, it's mostly viruses, really. So it's either caused by an infection or a direct recent infection or something that's latent in the body. We all have, for example, the herpes virus in our bodies, about 90% of us. And under certain conditions, it can pop up and infect the brain. In fact, the most common cause of encephalitis is a herpes virus. And again, it's not the STD variant, HSV1. And it can come on from overworking, from being exhausted, pushing too hard, having repeat infections, just being sick. We saw a pop-up of these during the COVID epidemic because the body being sick and not being treated. And I'm going to talk specifically about the side effects of a couple different forms of encephalitis to explain. HSV, herpes simplex virus 1, and the encephalitis it causes is nasty. And so are the long-term side effects. And we'll talk about some of the others. But this one is very aggressive and very disabling. So there are plenty of different, there are both those that are exclusive to people, and there are those that are referred to as arboviruses. Now, the family of viruses that are brought about by, the insects that are zoonoses that travel from animals to humans, are the arboviruses brought about by mosquito bites, ticks, by pests, as it were. Some of those can be pretty nasty too. And there's Japanese encephalitis, Western equine encephalitis, Eastern equine encephalitis. You can tell by the names who their primary hosts are. But fortunately, some of the nastier ones, like Eastern equine encephalitis, really you don't see many of those cases in humans. But when they do cross, when transferred by mosquito, they are pretty nasty, and the damage they do is pretty extensive. Both a high mortality as well as a number of sequelae, symptoms that are long-term. So if you happen to get one of these, it's pretty unfortunate. St. Louis encephalitis. Some of these are, of course, named for countries or states or regions that they come from. So West Nile, that's another, just want to make sure that I touch on the ones that I have. All right, and then so that's the ones I have listed for some of the bigger ones or ones that are better known. Bacterial forms and protozoal. Something that I definitely want to talk about, Lyme disease. That is definitely a cause of encephalitis. That is encephalitis with some meningeal involvement too. So that one would be considered meningoencephalitis, but it's a very common one. It is an arbovirus. It kind of crosses over between the two. Actually, allow me to correct that. That is bacterial. So it is a bacterial meningoencephalitis. Bacterial meningoencephalitis. So, okay, so how do we, how is the diagnosis done? There's a couple of different ways to do the diagnosis as a physician. I mean, first of all, CT scan, you want to rule out, for example, whether it's trauma or whatever else. So you definitely want to do a quick CT scan because you're looking for, just like in meningitis, you want to make sure that there's no risk of brain herniation, severe edema immediately, because you're also then going to be doing a lumbar puncture, just like before, to rule out meningitis because the symptoms are so similar. So that's first, based on symptoms and presentation. Then after that, a good quality brain scan. So you're talking about an MRI for details to determine where it is, what's going on. Then blood test, you got to identify what it is. You will be starting that same kind of empirical treatment. Remember how we talked about before in the meningitis? You will be giving them a third generation antibiotic. You want to have negative, gram-negative antibiotics as well, because you want to make sure you're covering both. You guarantee will also be giving them an antiviral. Acyclovir is good. It is the closest thing we have to a broad-spectrum antiviral. I mean, the truth is, you really can't hit, everything, but again, because herpes virus is just so common, you want to make sure you're covering that one. Steroids, maybe. Again, that's up for debate. Antifungal, it's kind of a big old cocktail to try and hit everything you can, prevent it from progressing and doing more damage. Then a PCR, polymerase chain reaction. You want to, of the cerebrospinal fluid, so it's like what you're dealing with specifically, and to look for its DNA, basically the viral DNA, or with COVID now, we know that COVID causes encephalitis, so there's always screening for that one too. There are antivirals for COVID, and we are starting to use more and more antivirals. So we kind of, there are treatments against other, as I said, so, for kids, immunoglobulins, basically, which again are part of what I had mentioned before about using specific therapies that are immune modulating, that help it identify viruses, that help the immune system basically train them, hey, this is what, it latches on to the proteins on the surface of the virus. Hey, look at me, I'm a bad guy. So that's essentially how it works. Again, in a lot of these cases, in a lot of these studies, what we find is like the results are maybe yes, maybe no. Inconclusive. I suspect because there's a lot more involved in getting the immune system to respond, because these bugs have had millions and millions and millions and millions and millions of years to evolve. They've been around since life has been around. And humans have been around for a long time, as have our cousins. So let's talk about herpes simplex encephalitis. Okay, As it's the most common, I can use it as an exemplar, okay? 90% of these cases are caused by the HSV1 virus. They're usually named by, what genus and species, just like Homo sapiens. It's the same virus that'll give you a cold sore. It's in the same family of viruses that will cause other, there are different ways to transmit it. It's like many of us get it, from mom or, whoever. Mom gives you a kiss, she's got a cold sore, whatever, you've got it. It's, for most of us, it's harmless. It's when our immune system is down due to fatigue or whatever else. That's when it gets us. So almost all of these cases, like of herpes simplex encephalitis occur in individuals who are positive with HSV. Some people have had orofacial. Well, that's when it expressed itself, all right? Half of those who get it are over the age of 50. Again, immunosuppression. So, what are the signs and symptoms? Most folks who have encephalitis due to herpes, one of the first signs and symptoms they have is their level of awareness, their consciousness, and altered mental state. They present confused. They're sleepy. Changes in personality. They may be more passive or more aggressive or more, and so they may have a fever. They may even have seizures. Remember how I said viral encephalitis is more likely to present, in such a fashion. They'll be sensitive to light, sound. They may seem like fluish too, but it's that some may have a headache. They may even lose their sense of smell. It seems almost COVID-like, and that right now is concern. So they need to have their cerebrospinal fluid tested. Excuse me. Some of them may have, like more aggressive behavior, or, Thing is, they need to get to a hospital right away, because if they do manage to survive, and it does have a high mortality rate too, for, it leaves you with some really severe symptoms. So the typical treatment is acyclovir intravenously, antiviral. Specifically, it's more for the herpes virus, but, it's like if you have no treatment at all, it usually does result in death. I've seen stats between 50 and 70%. So, that altered level of responsiveness, that is a red flag. Hey, take them to a hospital, especially if they have the other symptoms. Okay? So, and about 70% will have permanent neurological damage, even if they do survive. So, yeah. So, of those 70% that have neurological damage, about 20% have relatively minor. The rest of them will have much more severe. If you get them treatment within 48 hours, their chances are much better to have a good recovery. And we all know, I've talked about what good recovery means to a neurologist. So, it's like, it can include things like very severe, very dense memory loss. So they not only have trouble learning new things, they lose a lot of their past. They may forget, like, that they have, kids, or they may forget they're married. They may forget, moving out of the house. They may think they're 15 when they're in their 40s. Really serious stuff. They may, have something serious called a neuropathology of the self. This is a really hardcore disorder in that with a neuropathology of the self, you essentially regress to like when you were 3 or 5. And it usually doesn't get better. You may end up with partial Kluver-Bucy syndrome. That's something else really serious due to damage of the temporal lobes, bilateral destruction of the amygdala, parts of the anterior temporal lobes. We'll talk about this, but this is common in those that have serious neurological symptoms associated with HSV. It's one of the conditions that produces this syndrome. Very serious. Visual agnosias, trouble recognizing objects when you look at them or knowing what they are, all kinds of really serious stuff. So most people who have this with serious symptoms that survive are custodial. They are not capable of caring for themselves anymore. And this is the most common cause of encephalitis in the United States and Western Europe. All right. One of the other things to touch on is neuroborreliosis, the encephalomeningitis caused by Lyme disease. It's more circumscribed and more generalized than, obviously, than herpes encephalitis. However, this is one caused by Lyme disease. This one is common too. It's caused by delayed treatment of the Lyme disease spread by ticks, deer ticks. And it's a lot harder to put your finger on those kind of symptoms. They look almost like long COVID in a lot of ways, which is something else. And I'd like to talk specifically about some of these other things in later videos because, they should have their own videos. But because neuroborreliosis is something that a lot of docs dismiss because it seems kind of like, nah, you're not, fatigue is a big one. It's connected with chronic fatigue syndrome, we think. These conditions. And likely long COVID will have tie-ins, we'll find, because of immune factors. Neuroimmune studies are new and are very complicated. I've taken a look at something and it's like, what is all of this? So I got to read more on the immune system to make sense. And there have been a lot of new genetics discoveries, epigenetics, et cetera, et cetera, et cetera. And so it's complicated. But essentially, fatigue is common. Brain fog, which is essentially a processing slowdown. You're not as good at cognitive processing. You're not as fast. And so it experiences brain fog, some confusion. You don't process information as fast. So that's white matter damage in the corpus callosum. So you don't get information as quick between the hemispheres. So it takes longer damage to the minor forceps minor. We've discussed that before, but again, that's something that deserves separate attention. Problems with focus, endurance, adynamia, the usual frontal symptoms. You know this diagram. So these kind of things and the tie-in between neuroborreliosis and chronic fatigue and COVID, they're a lot harder to put your finger on, so people get dismissed. And when somebody who has a lower status in the eyes of the medical system or political system comes in, they're dismissed. So it's also a social problem as well. I hate to say it that way, but it's the truth. This is why we do what we do. All right, so that's the very 30,000, 40,000 foot view on encephalitis, caused by infectious organisms. There are a lot of them, and a lot of viruses that cause it. What I can tell you is, like, if you have, again, those meningitis type symptoms, altered level of consciousness, stiff neck, headache, fever, any of those that are strong, persistent, or if you've noticed that you or a loved one is having problems functioning like normal, and it's more, and it feels like anything more than just, go to the emergency department. Call 911, especially the usual three, which is that fever, that headache, that strong headache and that fever, and that stiff neck, and that altered level of consciousness. Those symptoms, technically it's 4, because also with that stiff neck in there. And it's not always present. And all 3 or 4 of those symptoms, depending on who you talk to, those 3 or 4 symptoms are not always present together. You may get 2 or 3 of them. But if you can see those 2 or 3, that's get to the emergency department, okay? Call 911 as soon as possible, because many of these kill, many of these permanently disable. Be aware and know that there are certain seasons for different things. And if there are other factors in play, like you've been outside within the past, 2 or 3 weeks in the woods, or you've been camping, or if, you've gotten a bunch of mosquito bites, or if, you were sick with something that was like the flu just before, it should raise your suspicion index for that kind of stuff. Or, it's like, yeah, these are signs that it's smarter to go to the hospital, explain the situation, and be wrong, than it is to dismiss it. And suddenly you're in that position of, whoops, and now I have blindness, deafness, I have seizures, I have, personality issues, I have trouble thinking, I can't be employed anymore because I dismissed something out of fear of being wrong or looking stupid. Having permanent disabilities, or having to throw dirt on a loved one because of pride. It's not worth it. So if you have these symptoms, it's always worth having them checked out. All right. So if you have any questions, comments below, please, down there. And this pretty much wraps up our series on the infectious species, at least at the basic level, for infectious disorders that cause acquired brain injury. Next, we will be moving into internal problems. So like diabetes, liver failure, kidney failure, autoimmune disorders that cause brain injury, things like that, which would include the autoimmune-based encephalopathies. So hope you learned something. Please check out our website, friendswithbraininjury.com. Please check out, other videos that are here. Please look at, we have a Facebook group. Check that out as well. And then hope you have a good day. Bye.